not be a victim of somebody's carelessness or mistake. Wait, before you say amen, I want you to watch this video. Watch this video to the end and don't skip any part. Especially if you have a relative, a family member, or a loved one in any hospital. Or before you take any member of your family or your loved one to the hospital, I want you to watch this video. Watch this video. And as you watch, like, comment, and subscribe. Share this video. Share it so that it can get to as many people as possible so that they will be aware of the wickedness that is going on in the hospital. I want you to share this video. Share this video.
What's
now.
up, guys? It's your girl Neye baby. So guys, I have this lady here today. She contacted me. For the first time, she's a nurse. Guys, let's listen to her. This nurse here, she has something she wants to tell us. All right, please watch this story from beginning to end and hold your heart like this as you're watching this story, like I'm holding my own. I have to comport myself because she has already told me part of the story before we start. As she mentioned, she's a nurse. I say, hope is something we can say out for people to listen. She said yes, that she need to do this confession. I said, okay. So let's listen to her, please. Okay, no mention your name. Just go straight with your story.
So, good afternoon, everyone. I've been meaning to say this story because I need advice. So, I'm a nurse in an hospital. I used to date a doctor. We used to date each other, and we used to run the same shifts. Like most of our shifts, it's always the same thing. Like we'll go home together, we'll come to work together, and all of that. And even if he wants to sleep with me, he calls me. We go to his house. In the morning, we resume the same shift. We are always in the same shifts. Though our relationship is private because we don't want it to affect our work. But still, some people notice, but it's still private. And the doctor has promised me that he's going to get married to me. Like we are planning to get married to each other. So, as all along all this thing was happening. So before recently, like after everything and all of that, because we have been dating for over 3 years. So after all, he started acting strange and weird and started giving me excuses and all of that. And he has never done that before. In fact, he doesn't even wait for me anymore to go home together. He doesn't call me and all of that. So I started wondering what could have been the problem that, what could have happened to, did I offend him or anything? So, but all this, why I'm pondering on all of this issue, before I know it, I saw a group of people talking about him, that he started dating a new nurse. Of course, I was aware that the new nurse was, they employed a new nurse in our hospital, but I didn't think he was actually dating her or anything. Like, I trusted him and I respected this doctor because he's a senior doctor in our hospital. I trusted him and respected. I didn't think he was going to do anything of such. When I heard this, I was heartbroken. It pained me so because he stopped picking my call. He doesn't talk to me. He gives me excuses. I've not seen him. Like I've not seen him unlike before. We usually see each other every day, every minute. But for some reason, I don't see him anymore. It's just like he's avoiding me and all of that. So when I heard this story, I was so pained and disappointed. I felt betrayed. Like it played with my emotions. Like I cried. It was so painful that. What could have made him left it? Like, did I offend him or anything? And this new nurse that we're talking about, she's a size 12. A size 12 or 14 because he told me he does not like fat person. He told me he does not like someone that is fat, that he likes my shape, that I'm looking good, that he likes someone that he can carry when we are sleeping together, when he's sleeping with together. I like someone he can carry that can do all kind of stuff. But this nurse in question is fat, size 12, and I'm even better in everything, even in beauty. I'm better than this lady. So what would have made him left me and go for this woman? I was so pained and angry. I was so disappointed. I felt betrayed. Like it's just like he played with my emotions. Like,
did this doctor promise to marry you?
Yes, he promised to marry me, that we're going to get married and all of that. That he does not like noise too much. That was why we even kept it private. He promised he was going to propose to me and I'm going to get married. So I don't know. I thought I was one that did something, but I now realized that it's not me. That he just moved on to another person, and he didn't tell me about it. Like he didn't properly break the relationship or anything. He just stopped picking up my calls. He stopped talking to me. He stopped picking me up. Like our shit no longer aligned to each other again. because before we always end up in the same shifts. It's just I don't know if he's the one setting it, but our shift is always the same. But now I barely see him. We always avoid each other. So I got angry. I said no, he cannot just do this to me and go scot free. Like I must make sure that they sack him from this hospital. That was my plan. Because the thing was bothering me. I can't even sleep. I can't even sleep. I felt so heartbroken. So I said, no, I must make him feel the hurt. I must hurt him the way he hurt me. So he will feel what I'm feeling right now. So I plan to do something. I plan to implicate him in that hospital so that they will just sack him or something, whatever. So he usually administered drugs to people that are going into emergency or surgery before they do surgery for them or before they do anything for them. He usually administer drugs, and his drugs is always very effective when he administer it. He knows what he's doing. So on those occasions, if he administer drugs for them, I will sneak in and then alter the this thing and change it. Like if he wants to give patient 2 drugs, I will put like 1. If he wants to give patient 1 drugs, I'll put like 3. Like I always altered it. So this
You always alter the drugs
prescription.
from that doctor.
Yes.
And you say this doctor knows what he's doing.
Exactly, he knows what he's doing. It's like I told you, he's a senior doctor, so everybody used to go to him for him to administer drugs to patients before they operate on them. So, but now I always altered it and change it so that I always be very cautious. I don't want anybody. I don't even want him to know that I'm the one doing him. I don't want anybody to know. So I'm always very careful when I sneak in and then alter the prescription like that. So those things have been going and it has been affecting the patient. Like most of them, when they start operating on them, they will not respond. So some of them usually withdraw. Most patient family will withdraw the patient. It's like these people don't. This hospital is no longer treating patients the way they want to. They are no longer effective. They're already doing something else. So patients started dropping, or the number of patients coming to do surgery started dropping. So and the hospital people started blaming the doctor that why will he administer things that is not. He tried to defend himself, but he doesn't even know what went wrong. He can't even say this is where it went wrong, because if me I'm altering the prescription, I don't let people see me. I always try to hide or be very careful. So they don't know. He doesn't know where he went wrong. Even himself, he got to a point. He started asking and saying he does not know what is going on. The review about
So
him.
you mean after giving prescription, you will go and do your own?
Yes, I'll go and alter the prescription.
Why?
Because what he did to me was so painful. I can't just let it go.
How does relationship go with people's drugs prescription?
I'm not, it's not the patient. I do it in a way that it will not affect them. The only thing is they will not, but of course the prescription is not effective. Like it's just as if someone is having typhoid, I'm giving them how will I put it, a running stomach pills. That's what I usually do. It's not as if it's very harmful like that. It's just that they will not respond to operation or anything anymore, because the drug he administered was supposed to prepare their body for the operation, something like that. So I'm very careful. I don't want any patient to die. But my own is I wanted to implicate him. I wanted them to see the kind of person he is. That he's not the respectful person they thought he is. I wanted all the good reviews about him to turn negative. And it was working, but that was not what I really wanted. I wanted them to sack him. My main intention is for them to sack him, because once this negative review pile up, they will sack him. That was what I was waiting for. So I was doing all this because I could not sleep. I was doing all of this. Then one day I wanted to alter the prescription as usual. Then I went into the room. I was very cautious as I always was. Then immediately as I was altering it, I already changed it just for me to leave. A nurse came in and caught me. I was scared because how do I explain? Because of course they've been looking for who. It's not as if they thought it was him, but now that they saw me there, they will ask me. The nurse was like, "What are you doing there? Why did you alter the prescription that was given to you to the patient? Did you know the patient from anywhere? The patient did she offended you from anywhere? Like is the patient related to you? Do you want to the patient?" I said no, that is not the patient that is the target. That the patient did not offend me. The patient is not the target. I just want to know, is the doctor that prescribed the drugs that I'm after. She said she's going to expose me and everything. That means I'm endangering the lives of the patients in this hospital. That I'm giving the hospital bad name. That she's going to expose me. That all along I was the one messing with the doctor's prescription. That they thought it was the so doctor. She's going to make sure everybody knows. I started begging her that no, That is not the issue, that she should just hear me out, that she should please hear me out, that this is not what happened, this is not the situation. She should hear my side of the story, that I didn't just want to be altering any prescription, that what this doctor did to me is really painful, that she should please just hear me out. So she said, okay, that whatever the reason, if the excuses was not enough, but she's just going to hear me out, that even though that one does not change her mind, that she'll still talk. I said, okay. So I told her everything, how me and the doctor were dating each other for over 3 years, how he promised to propose to me, how I used to give him different style, that what have I not done for this doctor? What have I not done? That I've done everything possible. In fact, there's nothing he will tell me that I've not done for him. I've done everything. We used to sleep with each other everywhere, and you know that he's not even allowed in the hospital. I've pleased him in the way a woman will please a man. I've done it. We've dated. He has promised me marriage. All of a sudden, he just stopped talking to me. He stopped picking up my calls because of a new nurse that came in. Okay, she's leaving. She's leaving. She's leaving. Oh, she's leaving. Oh,
Is that how they appear?
that's how they appear. That's how they appear. Oh, I'm so scared.
What's your story first?
I'm so scared.
Oh, yeah, continue.
So that was how I was telling that lady everything. I was telling her and all of that. So I didn't even, the next thing I was expecting her to be like, wow, this is bad though. But she was not surprised though. Instead, she just told me that me, I've never seen anything. What the man did to me, that I was already trying to implicate him. The other nurse was that time, that before the man came to me, did I know the woman that he was with? Did I know the doctor's ex-girlfriend? I said no, that I don't know the doctor's ex-girlfriend. It was not like she's the one, that she has been the nurse before me. I came in, that the day I came, that's when this man has left him. Oh, since now the girl is here.
Which girl?
The twin girl is here. The twin girl is here. Yeah.
Where?
She's here. She's here. Oh.
I don't understand. Calm down and do your video now.
The girl is here. Hey.
You're not seeing her again?
Yes, she has gone. She has.
Hey.
How do I do like this?
The story is too long. But yeah, continue. Talk now.
Okay, so the nurse told me that she has been the other nurse.
How old is this girl you're seeing?
7 years old. 7 years old.
Oh yeah, talk now. Talk first.
So,
let's go.
So the nurse that told me that she has been the a girlfriend, that he dated her. That when I came, that's when he left her. That she didn't even quickly know. That I quickly know that he was dating someone. That she didn't even know. She has trusted him so well. That before she knows anything, it has gone far. That before she knows that I was dating the doctor, that it has gone far, that she even had IBP, that she also tried to make sure there's Saki, but who will she tell? Because they'll tell her that she's dating him, that they can't put out in relationship, that relationship goes bad sometime and all of that. That she said, she told me she developed HPV.
The doctor have already dated that girl before.
Yes, the doctor have dated that. That is even me that made that she left me. She left her for me. That me too, when I newly came, that's when the doctor left her and came to me. It's the same thing that the doctor is doing. That the lady said she had IBP, that she was administered at the hospital before she gets herself, that she just had to let it go. That some relationship are like that. And me, I was telling her that I cannot let it go. No, I can't, because I'm not okay. I'm not mentally okay. Is it affecting my work? I can't sleep well. That I can't let it go. That I must do something for him. I must implicate it for him to feel what I felt. So after that day, I was still administering, and I was still altering his prescription I give to the doctor. Even at some point, they stopped going for him for prescription. But there are some knowledge, there are some prescription that only him knows. So the ones that they are still going to him are still always hot high, and has been affecting most of the patients, but none has. Yes, they will not respond to treatment. They'll change them to another location.
Okay, so what you normally do is to make the drugs not work on the.
Yeah, I will change the drugs. The prescription I gave today, I will change it. Like I said, they're supposed to give them 3. I'll put it 1, and 1 cannot be effective the way 3 they wanted 3 to work. Or if they ask for malaria medicine, I'll go and give them running stomach medicine or headache medicine to use, and that one is not working at all. It's not effective, and those medicines are supposed to prepare their body for every other treatment that they are supposed to receive. So if they don't receive those medicine, those prescription, the treatment will not work. So that's what I've been doing today. I was continuing altering the doctor's prescription. So on one fateful day, they brought twins. They brought a twin, but it's not the twins they brought. They brought the boy. Like, the boy is twins. They brought him to the hospital. They wanted to treat him as well. So this doctor prescribed, as usual, I prescribed a treatment for him. So I went to water it as I always does and all of that, because since they've not sacked him since. So I went to water it, and normally if they prescribe 3, I will water it to 1. But this fatal day, I don't know. I went to water it to 5, excess of it. So when they gave the guy, the small boy, the boy is just 7 years old boy. So when they gave him drip and the treatment and everything, it was too much for his body and his age. It was too much, and they didn't even bother to cross-check it. And when they used it to him, use the drip and everything, all the treatments and the drugs for the guy, for the boy, the twin boy. So the boy system was not able to carry the prescription I altered. You know, the rest have been altering were adults, so their body would just reject it. But this boy system could not carry it, so they lost the boy. And I didn't know the boy was a twin. The twin boy, the twin girl, because the boy is twin boy and a girl. So the twin girl was at home. It's the twin boy that had issue, that was sick, that they wanted to treat, that I altered this thing, and they lost the boy and all of that. Immediately they lost the boy. Before you know, the mother was still mourning his son. They called him at home that the twin girl is also, that they lost the twin girl as well.
The second one at home.
Yes.
And she was not in the hospital.
And she was not in the hospital. She did not take the drug. She was not there. I didn't even know they were twin. They told me that they lost the twin girl at home too. And I was like, because I know that there are some twins that if one, the other one, if they lost one, the other one will follow, but not immediately like that now. Most of the time, you take like a year or 2. But this one, immediately the boy, it was not up to like few hours. They called the mother that the twin girl too. The woman fainted immediately. I felt so bad. I don't know what to do, because it was now on my conscience that I have 2 children. So since that day, since Nenge, it's the girl I'm seeing, no. It's not even the boy that I know. The girl that died, the twin girl. She's the one I'm seeing. Oh, she's here. She's here again. No.
She's where?
She's here.
Where is she? Where?
She's beside you.
Me. Where?
She's beside you.
Which side? What have you done since that time?
I've been trying. I've been looking for help. That's why I came to you.
You have been looking for help.
Help. I don't know what.
Where is the mother of that twins?
Where
is the mother of that twins?
I don't know where she is.
Over a year.
Yes. Since last year, since the year. I've been experiencing this since last year. I've gone to everywhere, nobody could help me. They say I should live with what I've done. The girl has been disturbing me. She'll just come and go.
Do you still work in that hospital?
No, I've left. She started coming to the hospital. I thought it's because it's the hospital, the twin boy. That's why she's stopping me. I've left there. I'm not even working again. Anywhere I go, this girl is coming to show face.
The girl, the twins.
Girl, and she's
not even the boy.
Not the boy, and she's not the one I administered something for.
And that was the one that was at home, and the next thing.
Yes, that alongside the twin boy. I don't know what to do. Please help me. What do I do? Please help me. Please. I don't know what to do anymore. Please help me. Oh.
And they just left the hospital like that.
They left the hospital. They had to go and bury the twin. And me too. I've left the hospital too. I can't go back there. Now she's following me everywhere. She's here again.
She's where?
She's here.
Is this how she follow you up and down?
So this is how.
But me, I can't see how.
Hey. Please forgive me. Why
did you go and try that thing? Why did you go and do it?
I don't used to do it to affect the patient. This one, she's not living. She's not living. Oh,
she's still there.
She's still here. She's not living. Please forgive. Let me beg her. Oh,
I don't even know what to do. Beg who? I should beg who?
The twin girl. Let me beg.
Where is the mother of this twin girl now?
I don't know where she is. I don't know.
And the hospital is here in Lagos?
The hospital is not in Lagos. I have to leave there.
Where is the hospital?
No, it's in Ogun State. I have to run all the way, pack all my things and everything. I left my job and my home. I came down to Lagos, but she followed me down.
Okay, the hospital is in Ogun State?
Yes, the hospital is in Ogun State.
You have to run to Lagos?
I have to run to Lagos, and she followed me down here. Oh, she has gone now, but I don't know where she goes. Please help me.
She used to go and come.
Please help me. What do I do?
Okay, so let me round up the video. Sorry. Okay, guys, please, I don't want to say anything concerning this video. I have to leave here. It's not like I'm scared though. I'm not that scared, but my heart is just shaking. Like, why will you be fighting a doctor with patients' drugs?
But I just
Why?
administered to those. None of them are. Yes, they will not respond to treatment.
Then why did you do this one like this? Why will you do this
I
thing?
didn't even know the small child. I didn't know it was a small child. I just went to.
Okay, you will not even see the patients at all.
Yes, I don't used to see the patient. I'll just reduce the treatment. Not like with this one, I went to increase it from 3 to 5. I didn't reduce it. Oh, please, I made a mistake. Please help me. Please, is Naya, if you know anywhere that can help me, please. Oh, she's here again.
Who?
The girl is here. She's here.
She's okay. Where?
She's standing there beside us. Naya, please help me. Babe. I'm sorry. I didn't mean to.
You are sorry. Why did you do something like
I'm
this?
sorry. I didn't mean to. Your twin. So sorry.
Okay, please, I need to end this video. I don't understand.
I'm sorry.
Okay, let me say something, guys. Please, let's be very careful. Don't fight who did not do anything to you. Can you imagine what you just did? Eh?
I'm so sorry. I didn't mean to. I didn't mean to.
Must that doctor marry you? Even if the doctor did not marry you, if you want to fight the doctor, why not go straight to the doctor?
I regret my action. I didn't mean to do it. I didn't mean. I was just hurt. He hurt my feeling and everything, and I didn't mean to kill anybody. I'm so sorry. Please help me, please.
Oh, wow.
I'm so sorry. I didn't mean. Oh, she's here. She's on the.
She's where again?
She's on the my leg.
Jesus, please, let's end this video first.
She's on the. Please.